You guys can sit here. There's like 4 chairs. Yeah. Cheap shoes.
So our speaker is Stephen Harmon.
Well, I think we all know who Stefan is, right? He's been around. Well, he's talked several times. PA. He is owner of Iron Direct Primary Care in Indian Atlantic, Fifth Avenue.
Yeah.
Just off Fifth Avenue. He provides the latest in anti-aging and functional medicine, following an ancestral diet and being physically fit. Tonight he's going to talk to us about iodine in improving our health, preventing chronic conditions, and reversing diseases. So, as always, Stefan has great topics, great speaker, lots of great information. So, Stefan, the stage is yours.
Thank you guys for coming. Cool. We got a cool lecture tonight. I've given this talk a couple times to a couple of academic societies that I'm involved in. What we do in these academic societies is we review the forgotten medicines that have been developed in the past. There's approximately 500,000 known drugs out there. Most of them are forgotten and unused. And one of them that we're going to talk about tonight is iodine. Iodine, Lugol's iodine, and iodoral. This back in 100, 200 years ago, you go to the pharmacist and they would compound this thing for you and they would prescribe it for all sorts of conditions, right? So I have done a lot of research on this thing and I learned that it's pretty important and that the entire population, I would say everyone in this room, unless you're actually taking higher doses of iodine, is deficient. And this is based off of independent research I did at Iron Direct Primary Care. I tested now 100 patients at the practice. I've tested 50 patients' blood for iodine levels, and I've tested now 50 patients' urine for iodine levels, and not a single patient had enough iodine. There was one patient who was taking, probably the best multivitamin out there was Alex Jones. Alex Jones was onto this years ago. He had an InfoWars iodine product. This patient had a semi-decent level of iodine. But besides that, if you're taking iodine in your multivitamin, you say, oh, I'm taking iodine, this is good. It's not enough. 150 micrograms that's commercially found in most supplements is not enough iodine. And we have to get into explaining why that might be. Why is everyone deficient in iodine? We were told, the WHO and CDC said that, they told me back when I did my PA training, we sat down in class, and they were kind of like this. They showed us a picture of what iodine deficiency looked like. And it was this African lady, and she had a goiter. She had a neck out to here. It was obvious that she had a goiter. You could see this from a mile away. They said, look at this. This is iodine deficiency. Forget about it. You'll never see it here in the United States of America. I diagnose goiter all the time. It's here. I diagnosed a patient yesterday in Palm Bay, big goiter by ultrasound. But I see it in people. I can see it in their neck. They have big thyroids. Why is everyone iodine deficient here? The CDC, the WHO, they put it in our salt and table salt. Now, table salt has some problems with it in its own way. I don't recommend it to my patients to consume table salt as a good way of getting iodine. The Japanese, on the other hand, they consume between 3 milligrams and 12 milligrams a day of iodine in the form of kelp and seaweed and nori and kombu. These are things that my dad raised me on. He popularized, or he cottoned onto this macrobiotic diet back in the day. It was high seaweed diet. And I think one reason why that diet is so expensive is because of the high iodine concentrations. But here in the U.S., we're lucky if we get 150 micrograms. So that's 1/10 of a milligram of iodine per day in, say, some table salt. But there's competitors for this. There's competitors in the periodic table. This is called a column in the periodic table. This is called the halogen column. This is fluoride, or fluorine, chlorine, bromine, and iodine. So iodine, being here at the bottom of the periodic table, has less affinity for binding to your tissues. The ones above it, fluoride, is found in our tap water. It's in a lot of your commercial toothpaste, like Colgate, right? Your dentist may put it on your mouth, and your pediatrician may prescribe it to your children, because it's supposed to strengthen the teeth. However, fluoride serves really no purpose in the human body other than binding to the receptors where iodine would have bound to in the first place. This brings us to number 2 on the list, chlorine. I had my water tested by Culligan this week. Culligan came by, tested my water. He says, your tap water has 7 times the concentration of chlorine that is safe for a pool. I was kind of shocked to hear that. I do put filters on my shower heads, but he said it's not enough. I need to get a whole water filtration system. So chlorine is absorbed through your skin transdermally. It can go into your body, so you have chlorine in your body too, chlorine. So next on the list is bromine. You may not have heard about this one, but I guarantee you, you're consuming it every day. So bromine, and only recently, maybe the FDA has been listening to my lectures on this, but it was only on November 5th that the FDA decided to ban bromide in commercial products. Bromide is found in a lot of your vegetable oils, your breads, most processed foods out there have bromide. Bromide's been used as an anti-caking agent in bread products for the past, 100 years in the US. But it's been banned in the European Union. So you go to Italy, you eat a pasta out there, you can be rest assured there's no bromide in the pasta you get in Rome, because it's banned in Rome. You're not allowed to use it in bread products. But I don't even know how long it'll take to get it out of the food supply here in the US. It took the FDA 100 years to figure this out, that it is toxic to humans. It causes cancers, and it again binds to the receptors where iodine would have bound to. So iodine, your 150 milligrams of iodine that you're taking, your salt, it never stood a chance. The 150 in your supplements of iodine, it never stood a chance to actually get into the body and do something. That brings us to the thyroid. We've talked about this a couple times now. So, can anyone tell me what the second most prescribed drug in the U.S. is? No, Synthroid. It's synthetic thyroid hormone. Second most prescribed drug in the U.S. Why is that? Can anyone tell me why that's? Iodine deficiency. Yes. Literally all T4 is, that's what Synthroid is. It's T4. It's synthetic thyroid hormone. It's just a bunch of iodine atoms. It's 4 iodine atoms. And then if you want T3, the conversion from T4 to T3, which is the active thyroid hormone, right, that gives you energy, you need some selenium for that to happen. Maybe you need some B complexes. Then you get T3. That's what gives you the energy. That's what helps you, your metabolism improve, helps you burn fat. Your cognition enhances. You don't have the brain fog. You have the energy. You need T3. But it doesn't start without T4, right? And I don't think it's a Synthroid deficiency in the population, okay? I think it's an iodine deficiency. And if we were actually giving people iodine, maybe Synthroid would be the 10th most prescribed drug, or maybe the 20th, or the 100th. I think there's some people who actually need thyroid hormone replacement. I don't prescribe Synthroid. I think it's not a great drug because a lot of people, they can't convert T4 to T3. I prescribe typically natural desiccated porcine thyroid hormone. That's an interesting drug because if you think about it, it's really just dried organ meat. It's the pig thyroid that's been dried up and it's sold in a capsule. It has both T4 and T3 in it. I prescribe this to patients all the time because it works really well. You'll feel great on it. Get energy. And some people actually need it. But it shouldn't be your go-to. When you have a patient with low thyroid, you should look at their diet, and I guarantee you they're not eating seaweed and kelp. Americans don't do that. It's not part of our culture. It's a part of a Korean and Japanese culture, right? I don't think we're going to change that anytime soon. So we probably just need to take more iodine. Now, what else is thyroid important for? Well, the thyroid is your master hormone. It controls all other hormones in the body. So it comes down this way, pregnenolone. Pregnenolone is the mother of all hormones. It's the progenitor hormone. Okay? Pregnenolone converts down this way, the adrenal pathway. It turns into cortisol. It's your stress hormone, right? You need that. A lot of people may feel chronic fatigue, low energy. Maybe they've been stressed for a long period of time. They deplete their cortisol levels, right? And they may be running into some adrenal burnout. They feel tired all the time. It can be from here. It can be from here. It can be from here. What do they need? These patients need nutrients. They need they need electrolytes, sodium, potassium, magnesium. They need to hydrate their body. A lot of people are consuming plain water out there. yes, our tap water is full of chlorine and fluoride, so you probably should filter that or get spring water. But when you filter out your water, you do reverse osmosis, what does that do? Sucks all the nutrients out. There's no nutrients left in your reverse osmosis water. So what does that do? Depletes you more, depletes you of more nutrients. So we learned this back in basic biology class. There's 3 types of cells. So you have one cell, this is a super swollen cell, this is a normal cell, and this is a dried out cell. So the dried out cell is the person who's dehydrated in the desert, right? This is hypernatremia. This is someone who's not drinking enough water, and they're all shriveled up and dry. Their cells don't perform that well, okay? Maybe too much salt. This is the person, I'd say this is most Americans. They've been told by their doctors to drink a lot of water. Drink a gallon of water a day or something crazy like that. But they have not been told to drink salt because they've been told that salt is bad for you, that it'll kill you or something like that, right? That salt causes high blood pressure. It's not necessarily true. They're probably eating Chick-fil-A, McDonald's, right? That's what's killing them. That's what's giving them high blood pressure. And it just so happens that that food is very salty. True. But most people are drinking a lot of water. So what this is hyponatremia. Hypo. So the cell swells up. Can you imagine what would happen if your brain swells? Well, you die, right? Or you maybe have migraine headaches. You're chronically fatigued. So this patient may be electrolyte depleted. You add them some electrolytes back into their water, and suddenly their cells are this, right? Normal. This is what we want our cells to be. So we need electrolytes there. You'll feel a lot better there too. That's the electrolyte, my whole spiel on electrolytes. We should get into some other things here. There's some really hot topics recently. Folate and methylfolate and cyanocobalamin versus methylcobalamin. You may have heard of these before, right? And there's the recent Joe Rogan podcast. They had a guy on there named Gary Brecka. I've had about 5 patients send me this video now. That's why I'm talking about it. So he sells this program, and he says if you test these 5 genes, you're going to know which nutrients to take, and it's going to fix all your diseases. I don't think the genetic testing is there to be able to tell us this. The genetic testing he's talking about is something like MTHFR mutation. He correctly states in the podcast that 30 to 40% of the population has this mutation. Yes, that is true. I assume that in my practice, but I don't test my patients for this. Why? I just give them a higher quality B complex supplement where I tell them to eat an ancestral diet. Why is that? You will get methylfolate, and methylcobalamin, which is, I would say, a more bioidentical vitamin. I just came up with that, right? Your body processes it better. So instead of doing a $500 test to see if you have the MTHFR mutations and these other genes, you just eat an ancestral diet. You eat beef liver, has methylfolate in there naturally. Or you eat an oyster and mussels, it has methylcobalamin, B12 in there naturally, right? If you don't want to eat those things, that's fine. You just buy a better supplement. I only advise my patients to get higher quality supplements. You go to Costco or CVS, you get a supplement, like a multivitamin. Typically, they're cheaper forms of B vitamins in there. There's cyanocobalamin or there's folic acid in there. And as we described, a lot of the population doesn't tolerate these things very well. So why not just spend the extra money on a higher quality supplement? That's what I tell my patients, rather than doing all that testing. Another very important one we're going to talk about is vitamin A. Vitamin A, again, is found in beef liver to a very high degree. And there's so much vitamin A in beef liver. It's a fat-soluble vitamin like vitamin D, right? We all know about vitamin D, how important that is. Vitamin A is an antioxidant. So we're going to get a little bit into antioxidants a little bit later. Vitamin A is also a natural antiviral. It was the traditional treatment for measles, right? Vitamin A. You would give patients or pediatric patients suffering with measles vitamin A back 100 years ago. It's also very important for your eyesight and a lot of other applications. So you can get it, again, from beef liver. It's freely available if you eat the beef liver. Some good supplements will have vitamin A in there as well. Vitamin D, we all know about the importance of vitamin D3, K2. I like the K2 component of vitamin D. Every time I dispense a vitamin D supplement to my patients, it has K2 in there. Why is that? Well, there's some suggestion that it may be one of the better nutrients to take to prevent cardiovascular disease. K2 potentially can inhibit the abnormal processing of calcium. So calcium can deposit in arteries, whether that's a product of vitamin K2 deficiency or a product of chronic inflammation in your arteries from eating out at Chick-fil-A too long for many years. Regardless, I think you should take K2. Now, you can get that again naturally if you eat grass-fed beef. If you eat grass-fed beef, they're fed grass. Naturally, grass has high K2 in there. That transfers to the meat profile. So you can absorb this higher nutrient content by just talking to your farmer and getting a properly raised cow. And then vitamin D is also very important. It's actually a misnomer. It's not a vitamin. It's a steroid. Vitamin D is a steroid. And it's going to help support all your hormones over here, testosterone, DHEA, all of that. You need vitamin D to support your hormones. But besides that, it's anti-cancer. Vitamin D is an anti-cancer modality. Patients with higher vitamin D levels, 80 plus, have a much lower risk of heart disease, cancer, depression, you name it. There seems to be no end in sight in what vitamin D can do to prevent, but in deficiency, the havoc it plays on the human body. We all know this. We learned about this in COVID. But let's talk about other cancers. Breast cancer, prostate cancer, uterine cancer, ovarian cancer, and thyroid cancer. Now, these five, the one thing they have in common is iodine plays a role in their development. If you look at the research on iodine and these five cancers, you'll find that there's a good amount of literature out there to point out that iodine deficiency may play a role in the development of these cancers. This is not common knowledge. Unfortunately, it's not. I was recently at a lecture with, breast surgeons, and they were talking to us about their fancy breast surgeries. And I raised my hand and I said, what do you guys know about the relationship between iodine and the prevention of breast cancer? And they're like, what are you talking about? There's no evidence to support that. There's actually a whole lot of evidence to support that, but no one knows it. This is why I'm giving this talk so much. So all my patients at Iron Direct Primary Care are supposed to be taking iodine. So breast cancer. If you know a woman, they need iodine. The females require more iodine than men. One, because they have more tissues that require iodine. This may be also why women are diagnosed with hypothyroidism much more often than men, because they require more iodine. Their breast tissue requires large amounts of iodine. If you have a female that you know in your family, maybe a young woman, she has breast pain. Maybe she has what they call fibrocystic breast tenderness, all this thing. This is an iodine deficiency. I've had patients in my practice with mastitis, so an infection of the breast. We give them back topical iodine, Lugol's iodine. We improve these sort of infections. I have women with fibrocystic breast tenderness, breast pain. Maybe every cycle they get breast tenderness or pain. I give them iodine, and this rectifies the situation. So this goes to show you how important it is. The other critical element for the breast is selenium. On my YouTube channel, you can watch a lecture that I did with Dr. Kathleen Reddy. She's a breast surgeon, and she'll say, most famously on my YouTube channel, that mammograms never prevented one breast cancer. And the reason she said this, after doing 30 years of breast surgeries, taking women's breasts off and doing many mammograms herself, is that she didn't see that there was much use in saying that mammograms prevent it. She says that what prevents it is diet, exercise, and iodine and selenium, right? And breast mammography are good screening modalities, but they're not necessarily prevention modalities. I think there's a little bit of a confusion behind that. The second one that's very important for men to understand is the prostate. So I was involved in this international study called the Prostate Community Trial. And we are still trying to see if we can treat prostate cancer and decrease the size of prostates with ivermectin. This was because during the pandemic, the extensive use of ivermectin was identified to have a role in prostate. So this is interesting. So this is a study going on currently in the Philippines and around the world, and I've been involved in it to some degree, just seeing if there is a role in this. And it seems that the ivermectin does play a role in symptomatic relief with patients. So that's good news that we maybe have a symptomatic treatment for large prostates. But I didn't find that it actually fixed the problem. When they got off the ivermectin, the problems would come back. So that led me down kind of a deeper hole, trying to understand what's going on with men and this. And I came to iodine. I was like, well, these men are iodine deficient. I started testing these men, and lo and behold, they're very iodine deficient. So I'm trying to supplement them and rectify maybe years of iodine deficiency and growth of a prostate. But iodine is protective for the prostate as well. So men need to be aware of this. The second would be uterine and the ovaries. Now, our farmers are aware of this. So if you look at bovine research, they figured out that if you don't feed the cow selenium and iodine, the cow will develop uterine growths and ovarian cysts. This is a study that the Japanese, they figured out. They said, you got to feed the cows iodine and selenium or they'll start growing ovarian cysts. I found this was kind of interesting because we don't apply this to humans yet, but there's a lot of research to support this in humans as well. So I've done this now in clinical practice. I've given a lot of women iodine, both topically, transdermally, but also orally. And we are able to improve their menstruation so that every month they don't have the terrible pains. We call this in medicine dysmenorrhea. It's a term we use for painful menstrual periods. But if I give these women iodine, their pain improves, right? So this is quite interesting for me, just to be able to use something so simple and cheap to give a rapid relief to women when for years they may be taking ibuprofen, Advils for years and years to help this pain. When the treatment isn't a lack of Advil, the treatment is a lack of, it's iodine. It's treating with iodine. So I've been very happy to use that in practice. And then, of course, the thyroid. We can prevent the growth of the thyroid. We can prevent the cystic growths on the thyroid, colloidal cysts. If you Google colloidal cysts, cause, it's iodine deficiency, right? But I know patients who were diagnosed with this via ultrasound at their doctor, and they were not told it's an iodine deficiency. They were just told, well, we'll just monitor this, and if it looks like it's getting worse, maybe we'll do a biopsy at some point. That's not preventative enough for me, right? Just imaging is not prevention, right? Imaging is a good screening module, but we need to kind of take it back a couple steps and say, okay, why is this happening? Why are these things growing in the human body? And it seems to be, it is coming back a lot to iodine and the deficiency we're seeing. So again, we have to go back to how to assess for iodine deficiency. You can do blood markers. I've done this now 50 times, and I've proven it that everyone's deficient. I no longer test for this because everyone's deficient. If I test 50 randomly selected patients at my practice, and not a single one of them has iodine enough in their blood, they're all deficient. Some are very deficient, even by the reference ranges. The reference range is between 40 and 100 is like the normal reference range. I've had many patients below 40. So even by the normal reference ranges, they're abnormal. Okay. But not a great test. That brings us to the urinary iodine challenge test. So this is a cool test. Basically, I dispense the patient a 50 milligram tablet of iodine, iodoral actually, and they're sent a kit in the mail that I prescribe, and they have to capture all their urine for 24 hours. They wake up in the morning, they pee, they capture it, and that's called the pre-test. That, by WHO standards, if you test less than 0.1 on that test, you're iodine deficient. This is established by the WHO. But we take it a step further, and then after they take that pre-test, they take 50 milligrams of iodine, and they capture all their urine for 24 hours. They put it in a big orange bucket, and they stick it in their fridge. Every time they pee, they can stick the bucket in the fridge. And then they shake it up at the next day, and they pour it in a tube, and we send it off to the lab. So we got a pre-test and we got a post-test. The post-test will do, it will see how much 50 milligrams of iodine does to the body to dislodge the toxic halogens, chloride and bromide specifically. So I give patients 50 milligrams of iodine, and we see how much iodine it takes to kick off those toxic halides, which we, again, serve no purpose in the human body other than inhibiting iodine absorption and causing cancers and gastrointestinal disease and all sorts of nonsense. So routinely, I find that patients are deficient in iodine in the iodine challenge test. So when I give them 50 milligrams of iodine, 50 milligram iodine, we'll come back with saying, okay, in the urine, this patient had 25 milligrams of iodine. So if I give them 50 milligrams of iodine, and in the urine, we find only 25 milligrams of iodine, that means that 25 milligrams of iodine is what their body needed. They held on to that. The body's intelligent. It wants this iodine. It absorbs it. It keeps it there. Right? So we would call this 50% excretion. 50% excretion of iodine. Now with this test, we may also see how much bromide and fluoride is dislodged through this process. Because the bromide and fluoride, they've been sitting happy in your fat tissues and in your bones for years, potentially, because you're not taking any iodine. So they're not going anywhere until you start taking higher doses of iodine. So I found bromide to be very high in some patients. I found fluoride high in some patients who were very good about not using Colgate toothpaste. They've been telling their dentist for years not to put fluoride in their mouth. They weren't drinking the tap water either. And they were like, what the heck is going on? Why do I have so much fluoride in my body? I'm like, well, you're detoxing it. And they have detox reactions. So that brings us to detox reactions, also known as herxing. So the herxing is sometimes very uncomfortable for patients. Depending on how much toxicity they have in their body, they start detoxing the stuff. Now, it's going to go through the kidneys. And you need to hydrate really well. That brings us back to the electrolytes. You got to hydrate really well with electrolytes. You got to flush this stuff out of you. But you may need some antioxidants. You need to take more vitamin C, some N-acetylcysteine. You need to take a B complex. B complex helps with detoxification of these things. And of course, electrolytes. It may take a long time to detox bromide and fluoride that you've been accumulating for the past 30 years. It's going to take a long time, months. If you look at, if you read Brownstein's books, Dr. Brownstein, who kind of pioneered a lot of this, he had patients that would take months to detox this stuff. And he would have them on high doses of iodine for a long time, 50 milligrams, 75 milligrams. He was doing crazy doses. I do routinely 50 milligram doses on patients to help them detoxify these things, but also feel better. We have patients that finally start feeling more energetic. The brain fog lifts. They start finally losing stubborn fat that they've been holding on to for years. It may just because their thyroid's working better. That could do it. It may just because there's some things we don't understand about iodine, that when you're superbly deficient in it, it kind of slows down some certain processes in the human body. So I like this test a lot, urine challenge test. Oftentimes when new patients come to the practice, I say, well, if they don't want to take iodine, I'm like, all right, we can do the test. I can prove it to you. I can show you how deficient you are. And or you can just take iodine. I recommend most patients, they should be taking 3 milligrams of iodine every day, at least. Or eating, if they don't want to take it, some people are like really hung up on the naturals. You got to eat a lot of seaweed. Okay? Yeah. Japanese really love their seaweed. They eat a lot of it. And I don't think Americans are going to stomach that much seaweed, so I don't think that's going to happen. But some patients need a lot more. I'm taking 12 milligrams a day. Take it every day. Feel good. I know Dr. Pierre Cloutier, he's been into these meetings before. He's taken 15 milligrams for the past 30 years. 15, yeah. He's taken 15 for 30 years. And then I get some pushback from some surprisingly natural-minded colleagues who are like, well, you're going to give people thyroid antibodies by giving people iodine. So there's a whole natural movement that's a bit against iodine, and they're saying you have to completely eliminate iodine in the human diet. You have to avoid it completely if you have thyroid antibodies. I talked to Cloutier about this the other day. I was like, Cloutier, what is this? I haven't seen this in clinical practice very much. Where are they getting this? He's like, they're deficient in selenium. They're deficient in the antioxidants. You need to make sure they give them the antioxidants, and they'll be just fine. I monitor this in my patients. I'll monitor their thyroid antibodies. I have yet to see thyroid globulin antibodies go sky high by taking iodine. It gets us a theoretical risk, but with the people being so deficient in iodine, I don't think the answer is remove more iodine in the diet. All right, just based off the literature, this would worsen diseases, worsen cancer progressions. So I don't agree with it, and I know natural-minded people will disagree with me on that, but that's my take on it. So we explained a lot here. I'll open up the floor to questions on all this, anything from electrolytes, hormones, thyroid, iodine testing. Yes?
So what kind of iodine?
Yeah, so you can get a 2% Lugol's iodine. As I described before, this is the classic form of iodine. It's been around 200 years. You can get it anywhere. Amazon has it. It will taste like pool water. I have to warn you. Especially if you get up past 6 milligrams of that, 3 drops, that's pool. So when I get to 6 milligrams, I will prescribe patients Iodorol. So I just have them start taking Iodorol. It's a tablet form. It comes in 6.
What is that again?
Iodorol. I-O-D-O-R-A-L. Iodorol. And I'll prescribe it to patients in 6, 12, 25, and 50 milligram doses. Yes?
Do you have a recommendation for vitamin, a brand?
Yeah.
Because there's so many out there, it's hard to
Yep.
work through them.
Yeah, I can have Linda send out a link later to the ones I recommend, and you can order it that way. Yes?
Do you have a correlation of how much selenium to how much iodine?
Oh, yeah. So you don't need that much selenium because there's no competitors, right? Selenium isn't in this column of the periodic. If you look it up, there's no real competitors for selenium. So like 200 micrograms is plenty. And again, people will then say, oh, I ate some Brazil nuts. Isn't that good enough? Unfortunately, unless you know the Brazil nut farmer and you know he's not spraying glyphosate on his crops and he's not spraying bromide, he sprayed bromide on the crops too because it's an it's an herbicide. So your Brazil nuts may have more bromide than selenium. And if you look it up on Google, it'll say first thing, there's actually a high amount of bromide in Brazil nuts because of that same process, the herbicide, the spraying. So I don't say Brazil nuts are a good source of selenium either. I just take it purely in a supplement form. Yeah. Yes?
What about nascent?
Nascent, not familiar.
Oh,
Yeah.
I guess it's a way of processing.
Nascent iodine. I'm only familiar with the classic dose, Lugol's iodine, which is iodine plus iodide. So these two forms of iodine is what you need. Right. Yeah. Anybody? Yes?
Can you get too much, or is your body just get rid of what it doesn't need?
Your body should just urinate it out. And you can monitor with the urinary challenge test. You can continue to monitor your urinary excretion of iodine, and you can titrate the dose. So you say you do 25 milligrams of iodine for 3 months. We go back and test, and we see maybe your excretion rate goes to 80%. Maybe it's improved, and you're excreting 80% of the iodine. And that means you can save yourself on some iodine you're taking every day or reduce your dose. Right? Yes?
Can you talk about the common medications that have fluoride and bromide?
Oh my God, yes. Forgot about that. Yeah, there's really common medications that have both fluoride and bromide. Actually, 30% of the most common prescribed pharmaceutical drugs in the U.S. have fluoride atoms in there. Yeah. You can look this up very simply for yourself. You just Google your medication and you look at the organic chemistry structure of it. The organic chemistry structure will look something like this. Okay, it may have maybe they have this, 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 and then it'll have this on there. It'll have this, that symbol, fluorine. Just Google the organic chemistry structure of your pharmaceutical, and lo and behold, you'll find 30% of them have 1, 2, I've seen 3 fluorine atoms attached to them. And the worst offenders would be the statin drugs, Crestor, atorvastatin. They're full of fluorine. Second worst offenders would be Flonase and Flovent, the common over-the-counter intranasal steroid. You're shooting fluoride right up into your pineal gland in your brain. Not great. Fluoroquinolones, the antibiotics, ciprofloxacin and levofloxacin. They're terrible drugs. I don't prescribe them anymore. I used to think you could use them in certain indications, but they wreak some havoc on the human body. They deteriorate your tissues. They have a black box warning now for Achilles tendon rupture and aortic dissection. Yeah, I know a guy who got that. His aorta blew out. Not a good drug. Not just for the fluoride. I think it's for other reasons. I don't think the fluoride's the cause. It does cause mitochondrial disease too. I know some patients, back when I worked in psychiatry, and I traced it back to their fluoroquinolone use, and they got this weird mitochondrial disease. They were fatigued all the time, chronic pain, everything hurt. And I don't think it's reversible. So they're bad drugs. What else has fluoride added in it? Flonase. Fluticasone. So ipratropium bromide has literally bromide in the word in it. Bromide, it's supposed to help with the breathing. And it does seem to help with breathing, at least temporarily. I used to, use it in the urgent cares before I knew better. I prescribed it to patients with difficulty breathing because that's what I was taught is used for asthma. But if you look at what bromide does, it causes difficulty breathing. So it kind of is stuck in a rock in a hard place there. It's not my first choice now. I use other ones that don't have bromide in there.
We're going to do dexamethasone also has fluorine too.
Dexamethasone?
Pretty sure.
Hmm. Well, there you go. Dexamethasone. We'll add that to the list. Yeah, next.
Have you heard that fluoride dumbs you down and it's
Yeah.
a byproduct of
Didn't know if it's a byproduct of aluminum, but yes, it does dumb you down. So that brings me to autism and ADHD. So there is evidence to support the concept that iodine deficiency may be a causal role in ADHD and autism. So fluoride, we know it causes decrease in IQ in children. This is backed up by studies. But also it calcifies the pineal gland. The pineal gland is an organ in your brain. It secretes melatonin. It's another hormone we forgot to mention here. Some say it's your third eye. It's that gives you that higher sense of being. But the fluoride is known to calcify the pineal gland. And you can find in studies patients with high fluoride exposure have higher pineal gland calcification. And not a good thing. Yes, Brett. I believe the deficiency started back when we started fluorinating the water more, where there's more contaminants in the water, bromide. And I didn't think we needed this much iodine, maybe prehistorically, right, when we were hunter-gatherers. I didn't think it was a big deal back then. I think the little iodine maybe we got from fish, some shellfish, some oysters, that may have been sufficient. But as we polluted our bodies with pharmaceuticals, tap waters, just the air we're breathing, we're getting more and more of the toxic halogen exposures, which makes it much more difficult for iodine to even exert any effect on the human body at the, an ancestral diet level. Right? I'm a fan of the ancestral diet, but it's deficient in iodine. Right? Yes?
You know, any of the rocket propellants have any of the fluoride?
Yeah, rocket propellants, no, I'm not familiar with that. There's my blood, I recently tested my blood and I came back positive for, MTBE? Yeah, it's a jet fuel, gasoline additive and it's found in jet fuel. So I detected that in my blood and I was very careful about what I was consuming, but I think I was consuming it through the ice. I was getting ice from my fridge. So I know that was detected at least in my blood, but I don't know if it has fluorine in there. I don't think so. Maybe other things. Problematic for other reasons. Oh, yes.
I had a friend and she was sharing that she had Graves' disease and that she was on medication.
Ah.
And I said, well, could have done something naturally. Of course not. But if I don't take this, I die. And I said, what? She said, everybody that's on medication, to regulate, you die if you don't get the medication.
Yeah, so Graves' disease is an interesting one.
Wow. That's, dialysis,
Oh my God, yeah. Yeah, Graves' disease is actually one of those that is supposed to be, uncurable. I think it can be cured naturally. You have to kind of look at the root cause of that. What is they eating? Are they exposed to? What sort of pollutants are they exposed to?
What is Graves?
Graves' disease is an autoimmune thyroid condition. Yeah.
Instead of underactive, it's overactive.
It's overactive.
So all the symptoms you get with Hashimoto's is pretty much the exact opposite you get with Graves. But you actually have, it's more common, interestingly enough, in Graves. They have spontaneous remission quite more frequently than they would with Hashimoto's. I don't know why that is, but
Hashimoto's is common. Everyone's got that. Graves a little bit more rare, and that can be one where that's the one where the natural mind is say you have to avoid all iodine because it could potentially worsens the Graves' disease. Again, I don't think it's too much iodine. They're missing something else there.
And then the other thing was, I thought one time I was getting one really dark, like I was just having this thing in my throat where it was like up and then go away. And my sister said, "I bet you need iodine." Because I lived in Massachusetts and I moved to North Carolina. We had no salt. We had salt and water rivers and all that stuff. So anyway, I went to a naturopath and I took iodine.
Huh.
Well, then years later, a doctor said to me, "So there's a nodule in my thyroid or something."
Uh-huh.
And when I mentioned to the doctor, I took iodine, he said, "That did nothing."
Ah, okay.
And I never went back to that.
Yeah. Yeah. Yes. Yeah, kids need it too. So kids, you'll, especially I should mention, pregnant women need it more than anyone. So what was the study I was looking at? Oh yes, the placenta. So the placenta, they looked at placenta in preeclamptic women, so women who had hypertension in pregnancy, so dangerously high blood pressure. Their placentas were superbly deficient in iodine. Now, the preeclampsia is thought to be a magnesium deficiency, but iodine plays a role in magnesium metabolism. So yes, magnesium, they are deficient in that, but they may also be more so deficient in iodine. But more so, this is what I was taught in school, and it's still true, the iodine-deficient mother will give birth to the cretinistic child. So cretinism is a form of a low IQ, low stature child. And this is supposed to only happen, again, in Africa and developing countries. But as I've identified here, everyone's iodine deficient. So I think cretinism is something we see on a routine basis in the U.S. It's just not identified because we think of ourselves as a first world country where this should not happen. But children need it as well. They need it to increase IGF-1, growth hormone. Children will not grow without growth hormone. Iodine plays a role in IGF-1. So the children, if you want athletes, you need to give them iodine too. And they may do better in school too. They may improve their focus too. Their IQ points may increase. So give them kelp or give them some Lugol's iodine every day. 2 milligrams, 3 milligrams. Yeah. All children need it. Anyone else?
Just an answer to that question about the fluoride in the I found something particular for satellite beach. It's not in a jet propulsion, but it's in the fire extinguishing. On the base, they used fire extinguishing. It's all known as spin in the nose, and that had fluoride in there. It's PFOA and PFOS. That's perfluorooctane and sulfate and perfluoroganoic acid.
Wow. It's in the name, fluoride. Yeah.
They're not using it anymore, but they used it regularly for the drills, the fire drills.
Yeah, I grew up with.
There's still some ongoing litigation for the groundwater contamination.
Yeah. Yeah, this is quite personal to me because I grew up with kids who developed these cancers. I grew up with kids who younger than me who got these cancers, right? Thyroid cancers,
I think it's ongoing.
Yeah, it's still ongoing. So our area was particularly affected with the iodine deficiency and the fluoride toxicity. Yeah. Yes.
I was diagnosed with jet fuel too from a naturopath, and I know where your office is. We're in the Atlantic, right by the airport.
Perfect.
I love to open the windows, and all those planes are going overhead.
Yeah. Yeah, they are. That's it.
Yeah, that chemical is very common in additive for your gasoline. That's why everybody can find traces.
Yeah, MTBE.
Yeah.
In the body.
Underground tanks leak.
Exactly.
Yeah, so. Yeah. And I'm super careful, and I had it in my bloodstream, the MTBE. So.
Another question, what is the reference range that you use for your blood test?
Yeah, so that's a standard reference range, 40 to 100. But I've tested patients, and they've been very high. My blood was 180, taking just 3 drops of glucose iodine. I had one patient taking 7, and his was 270. So, after that, if they start taking iodine, I don't test it anymore in the blood. I just, based off how their thyroid responds, I look at their thyroid markers. I look at how they feel. I look at women and see how they tell me how their breasts feel, how their uterus feels, their ovaries. We may do imaging. That's where imaging may play a very powerful role. You can do repeat mammography, thermography. You can do prostate screenings, ultrasounds. And that can tell you if you're doing the right thing, if these things are shrinking. Is the goiter going down in size? Goiter should go down in size with iodine. You monitor the ultrasound, you see the goiter shrinks. Right? This is what I'm going to do for some of my patients with goiter. Thermography. A lot of patients will come to me with thermography. In the thermography report, the thermographer will describe maybe an estrogen accumulation in the tissues. And in the report, we'll say this patient may be low in iodine. You should test them for iodine. Right? That's a common report I see every day. It's women with a thermography report that says they have possible estrogen accumulation in their breast tissues, in their uterus. Now, what happens when you accumulate too much estrogen in your breast and your uterus and your ovaries? Well, estrogen isn't a bad thing. You need it. It's an essential hormone. We replace it in women, right, to improve their vitality, their skin strength, their bones. We prevent all sorts of risk factors. We decrease their cardiovascular disease risk. But if they're not metabolizing estrogen correctly, they're low in iodine, they start accumulating it. And this can potentially lead to proliferative disorders, right? So my conventional friends, they say that estrogen, too much of it causes endometriosis, a proliferation of the lining of the uterus. They say they put women on estrogen blocking medications when they have breast cancers because estrogen is supposed to be the causative agent of these proliferative diseases. I don't think estrogen is a bad thing. I think estrogen is critical to survival. We wouldn't have the human race without estrogen. It's not an evil thing, but we need to metabolize it correctly. And how do we do that? Well, with exercise, with a proper diet, with iodine, with vitamins, by avoiding as best we can the things that disrupt our hormones, the perfumes, the colognes, right? The fluoride, all that stuff that mimics estrogen in the body. But yeah, I don't think estrogen is the causative role in these things. Yes?
What about the buildup of the estrogen? Can that cause ovarian cysts?
Yes. Yep. No, this is pretty well established. And what do conventional doctors do? Well, they put women on birth control.
This is my daughter.
Yeah. What does birth control do? Did you ever ask?
We went off of it because it was
No.
awful for her.
That's awful. What does it do to a woman? Well, it shuts off their natural hormone production and it provides them a synthetic hormone. So this is one thing I've done, and I'm surprised there's actually no studies on this. When you test a woman who's on birth control and you test her hormones, lo and behold, what do you find? No detectable hormones. Where'd they go? It's because you're shutting off their natural production. And so you test them, and the lab testing that I can do, they do not detect synthetic hormones. So the synthetic estrogen and the synthetic progesterone that they're getting is not detectable. It's not a natural hormone, so I cannot detect it with the testing that I have available. But what it does do is it shuts off their natural progesterone, and it often shuts off their natural estrogen if it's an estrogen-containing combo there. And it often shuts off their natural testosterone production as well. So this, I'm surprised this isn't more of an ethical situation for my colleagues, because we would never prescribe a 15-year-old boy testosterone injections, right? Because that wouldn't be ethical. Because what would that do? It would shut down his natural production. But we have no problem putting a 15-year-old girl on birth control, even though it does the same thing. You're giving a hormone back to the body that suppresses the natural production. So I don't know why anybody else has not thought of this and how weirdly unethical it is, but we just consider this normal. Girls get it. Oh, guys, boys can't get it. Oh, I don't think you should prescribe testosterone injections to boys. It's either at 15, they hardly have something else wrong with them. That's why they need it to increase their testosterone levels. So that's my take on it.
Just by increasing the iodine, that increases the
Iodine.
cysts and
Yeah, where's my thing? I got rid of it. But yeah, iodine is critical for the production of progesterone. So if you have someone a low progesterone, you want to increase their progesterone, they need to fix their diet. A lot of things go into this, but iodine does play a critical role in the progesterone production as well, and also the estrogen metabolism, right? Yes, Mom?
I remember when I met Thomas, and he actually had a kitchen in Munich, and he was macrobiotic. And at that time, my periods were so bad, I found out later that I had the same pain as if I was in labor. Terrible, terrible periods. And the first month he was cooking, like the full moon, and I had 0 menstrual pain. And I was like, I'm going to become macrobiotic. I thought this was the correct diet to eat forever. And I guess it was, the aroma's delicious, the way he cooked it.
Arame is a seaweed.
Yeah, with the sweet carrots and the onions and the covered in soy sauce.
Yep.
So I ate a lot of it. So it was probably.
Yep.
So everybody find somebody who's got bad menstrual cramps and give them the Lugol's or have them eat arame for a month and see what happens.
No, I have the same. I think I told you the same experience when I started the Lugol's. Zero cramps in my cycle.
Yeah.
Same thing happened when I was in ketosis, but also when I did Lugol's, I had like no pain at all. It was wow.
Lugol's.
Yeah,
Lugol's.
you just need to eat like 5 grams of arame. Like it has already like 7. I think it was 7. I need to look it up again. But it's you need a scale, a super fine scale, and measure that 5 grams out. And then you soak it in water, and you can eat it just basically raw, which is if you want to, or you can.
Amazing.
Arame is the best to eat.
Did I ever eat that? Did you ever feed me that?
Yes, arame. We always had it.
Oh. Foofy. It was a long time ago. It's on Facebook. It's on my Instagram page. Not my Iron Direct Primary Care Facebook page. Yeah.
Is there an upper limit of what your iodine should be if you have Hashimoto's?
So the Hashimoto's, monitor the thyroid antibodies is what I would tell my patients. We monitor their thyroid antibodies. But I would put them on iodine at the dose that the urinary iodine challenge test determined, right? Whatever dose that was, and that's the dose they would get. And we would continue that and monitor for improvement in their symptoms, but also improvement in the laboratory values.
Can you give your Facebook name again?
Oh, yeah. It's, so it's Iron Direct Primary Care. Primary.
You can put all that in minutes.
Yep.
Send them out that way. You don't have pen or pencil, you write it down wrong.
YouTube channel. Did you bring some samples or some, are you going to show us?
Yeah, I brought some electrolytes. I brought some element electrolytes in case anybody wanted. Yeah, so that's for patients only, but I brought some here just if anyone wanted to buy one. What else did I brought here? Oh, I brought this. This is the topic of my latest YouTube video I published this Monday. This is acetylcysteine. This is a nebulized form of acetylcysteine. It's by prescription only. And it's a little known drug here, but again, this is one of those old repurposed drugs. They've been using this for years, back before there was a treatment for cystic fibrosis. You know, cystic fibrosis is that mucus disease in the lungs. They would prescribe it to these kids so that they could breathe it in and could break up the mucus, could help them breathe. I prescribe this all the time to congested patients as a natural remedy. I prescribe it in a nebulized form. They get a nebulizer, they breathe this in, and it helps them breathe. It helps get that antioxidant into the lungs. The lungs are basically a sponge to absorb nutrients. What better way to get it into the body than into the lungs? But then it thins the mucus, helps you bring it up. We use it also in COVID. It's been studied in COVID the COVID lung injury, that hyperinflammation of the lung, you breathe in that acetylcysteine right into the lung. It helps treat this. So you can, if you're interested more in this, watch my YouTube lecture, Iron Direct Primary Care. I published this Monday. I gave it to this lecture to another academic group that I'm involved in. That's the group I was describing. That our job is to research the old forgotten medicines and repurpose them again. And then here's NAC orally. You guys are aware of this one. You can take this as a capsule every day to improve your stores of the precursors of glutathione in the body, the antioxidant N-acetylcysteine. We've been using, all of you have been using this to treat and fight COVID in the pandemic. We're well aware of that, but a lot of you don't know this nebulized acetylcysteine is a commercial product. You can get this on Amazon Pharmacy, get it prescribed, and ship right to your door. And it's a great thing to keep on hand. Yes?
And my husband and I were wondering, can kids take ivermectin?
Yeah, prescribe it to children all the time. Yeah. Why do they think she has asthma? Okay, yeah. Yeah, there's definitely a nasty virus going around making my patients cough for a long time. Yeah, don't use ipratropium bromide. Ask for something else. Yes?
So with the acetylcysteine,
Yeah.
are you finding that it's, so if someone has some long COVID issues and the cytokine markers in the lungs are high, is this something that would be helpful?
So you're talking about long COVID?
Long COVID.
Yeah, long COVID different. We have a whole lecture on that as well on the YouTube channel. But long COVID has a whole different protocol. This is for acute treatment. This is for a patient who just, is coughing, has mucus in the lungs. We give them this. Yeah. Not a bad idea, long COVID, but we use it primarily in acute treatment, right? Yeah.
Okay, another fantastic lecture.
Very good, very good.
Coming and talking to us about iodine and some other topics.
Yeah,
You could go on probably all night.
probably could. Finish this.
Questions on the health.